Our hair is said to be your crowning glory with a significant cosmetic factor. Patchy baldness is a disorder with significant adverse psychological effects with negative influence on social interactions. In this video, we will discuss treatments both with conventional medicine and most known effective alternative remedies you never thought it existed. Welcome to our channel, Doctor on 2. We are a group of dedicated medical professionals and herbal researchers. We have painstakingly researched an up-to-date version of many treatments for alopecia areata in this video.
75-year-old male back pain, 211 Silver Hollow Road, between Lane Road and Crosspatch Road. Repeat, 75-year-old male back pain, 211.
Hair has a follicle that is attached to a capillary system for nutrients and oxygen. Growth factors reach the root of the hair to tell it to grow, but now and then follicles can get attacked with inflammation as a result. This process is seen in patchy baldness, also known as alopecia areata. It is an autoimmune disease characterized by non-scarring bald patches that can affect any place on the body. All this means that your immune system mistakenly attacks hair follicles by surrounding them and attack your hair roots. As the result, hairs get weaker and fall. Unfortunately, it is a chronic disorder with a prevalence of about 2%. As a rule of thumb, since this condition of most people is self-limiting, it makes sense to be hesitant with active treatment. More than half recover without treatment within 6 months to 1 year. However, in some cases, the symptoms persist, and in a minority happens a complete hair loss on all or part of the body. If an adult gets isolated spots centrally in the scalp and not along the hairline, the chances are high that this will normalize. Admittedly, there is a risk that the problem will recur. Unfortunately, boys with asthma or allergy or atopic disease who get a hair loss that creeps up from the hairline in the neck and up behind the ears aren't that lucky. There is a greater chance that it can cause permanent changes. I will now discuss only treatments that has clinical evidence shown effectiveness, especially the latest research and the newest medicine with promising results. Remember, home remedies comes after conventional treatments. The main goals in treatment alopecia areata is to block the immune system attack and stimulate the regrowth of hair. Studies have shown topical corticosteroids improved regrowth of approximately 25% with the use of highly potent types. Also, injection in bald areas with corticosteroids, and in severe cases, by using systemic drugs in the form of pills for extensive hair loss has shown effects but with different results. Minoxidil appears to be effective in the treatment of alopecia areata in patients with extensive disease 50 to 99% baldness. Response varies from 8 to 45%. Topical minoxidil are usually applied in combination with topical corticosteroid medications. Anthralin is a tar-like synthetic substance widely used for psoriasis, but it is a common form of treatment for alopecia areata too. It's applied once a day from 30 minutes to several hours depending of type and severity of the disease. Ultraviolet light (PUVA) is a controversial treatment that has been doubts of its real efficacy. Although narrowband ultraviolet B phototherapy is a well-established treatment in many dermatosis, there is little evidence of efficacy of this method for alopecia areata. Actually, some studies have indicated that UV radiation can speed up hair loss. For those who suffer from androgenetic alopecia, UVB oxidizes the hair's pigment cells, which is why your hair becomes lighter in the sun. UVA, on the other hand, can have a long-term effect on the integrity of your hair. Recent research has also shown that platelet-rich plasma therapy, or PRP, is effective at treating alopecia areata. A 2017 study in Italy also found male patients had increased hair improvement about 30% to 40% after 3 months. Janus or JAK inhibitors, used both systemically or topically. These drugs such as tofacitinib or Xeljanz and ruxolitinib or Jakafi are a new type of therapy being tested for alopecia areata. They are not approved by the FDA for alopecia areata yet and are only available right now in the form of an oral medication. Other topical immunotherapy is used to treat extensive alopecia areata, alopecia totalis, and alopecia universalis. Chemicals such as diphencyprenor (DPCP), dinitrochlorobenzene (DNCB), or squaric acid dibutylester or SADBE. Approximately 40% of patients treated with topical immunotherapy will regrow scalp hair after about 6 months of treatment. Methotrexate and cyclosporin are other immunotherapy medicine that appears to have some effect on patchy hair loss, although latest research has shown cyclosporin aren't as effective as methotrexate. It seems the latter is a promising and safe medication for the treatment of severe alopecia areata when used alone or in combination with corticosteroids. One study on methotrexate with a dose of 1,000 to 1,500 milligrams observed regrowth in 68% of patients, with the best responses observed in those with less than 5 years of disease progression, mostly in male patients over 40 years, and multifocal alopecia areata. It also believed that combination with systemic corticosteroids increased regrowth to 77% of patients. The therapeutic dose ranged from 10 to 25 milligrams per week. Vitamins are often glamorized as a treatment for hair loss, but evidence are inconclusive. Some studies pointed to vitamin B7, vitamin D, vitamin E derivatives, calcium, iron and zinc has effects on having a healthy hair. Deficiency of vitamin D is a risk factor for developing alopecia areata, and that a significant number of patients with this condition had low levels of vitamin D. Deficiency of zinc can result in growth retardation, delayed puberty and alopecia. 50 milligrams zinc supplement shown to be beneficial for treatment of alopecia areata.
Capsaicin is an active component of chili peppers. It is a chemical irritant and produces a sensation of burning in any tissue with which it comes into contact. Pure capsaicin is a hydrophobic, colorless, highly pungent, crystalline to waxy solid compound. Oral capsaicin 6 mg plus isoflavin 75 mg daily for 5 months increased mentioned hair growth promoter factor IGF-1, so it can be used to treat patients with androgenic hair loss and alopecia areata. In androgenic hair loss specifically, 88% observed hair growth following treatment. You can also apply capsaicin cream daily to affected scalp. It has been seen good effect in patients with alopecia areata after 3 weeks.
The effectiveness of topical crude onion juice in the treatment of focal hair loss compared to tap water was evaluated in 62 patients. After 8 weeks, 87% of patients treated with onion juice showed full hair regrowth versus 13% using placebo. Onion juice has been shown to successfully treat patchy alopecia areata by promoting hair growth. It is also thought to improve circulation. Blend a few onions and squeeze out the juice. Apply the juice to your scalp and hair and leave in for at least 15 minutes 2 times daily. Although the mechanism of topical onion juice is unknown, it is thought that sulfur and phenolic compounds cause a contact dermatitis, stimulating hair regrowth through antigenic competition. It is thought that acupuncture can increase circulation, stimulate hair follicles, and decrease inflammation. 78 patients were treated with either plum blossom acupuncture of the alopecia areata or topical 2% minoxidil daily, with total hair regrowth in 58% of acupuncture patients versus 34% of minoxidil patients, although additional scientific studies are necessary to clarify results. Stress can disrupt the process of hair growth and lead to premature graying. Try to avoid stress. Also, hot showers dehydrate hair and strips the scalp of its natural oils, leading to dry, brittle hair that's more prone to breakage. At last, avoid combing your wet hair because they are never more fragile and prone to breakage when wet. We hope you got what you came for. Our goal is to educate everyday people to a degree that they can choose a treatment for themselves and help others in need. So until the next video.